Today is one of those days where I am going to be unjust and unfair because it's my channel and I get to do that. Um, if you have the freedom to leave whatever comment you want, I have the freedom to talk about whatever I want. This has nothing to do with comments. And actually, the majority of the comments I have gotten in general have been actually very lovely, so I don't even know why I started off antagonistic towards you, because you're not the problem. You're not the problem. I'm going to talk a little bit today about medical gaslighting. Um, I am going to be talking about issues relating to the body and bodily sicknesses, issues, if any kind of medical stuff or reference to normal bodily functions bothers you. This is not the video for you. Um, so, do with that information what you will. So, I haven't been feeling well. And let me tell you why I haven't been feeling well. I have been having repeated UTIs, urinary tract infections, on and off for the past several months. I get them really easily in general for whatever reason. I don't know. And then I had one a couple weeks ago, got an antibiotic for it, and the symptoms did not resolve, which, if you have a UTI and you take your antibiotic all the way through and your symptoms don't resolve, the thing you do is go to see a doctor. Well, I had an appointment with my gynecologist coming up like right as soon as the antibiotic finished. And so I saw her and I was like, all right, I am still having symptoms. I'm still having, pelvic pain, nausea, the other symptoms associated with a UTI. And I, was like, well, normally if you go to the gynecologist, they take a urine sample, like kind of as just a standard. Usually, if you're sexually active, to check for pregnancy or any issues there. It's just kind of a routine thing they usually do if you have to see that type of doctor. And seeing that type of doctor is always so fun for those of us who identify as trans men or transmasc in any way, because, it's so fun to remember that you have ovaries and a uterus. That's just a lovely thing to be reminded of. So I was seeing her, and I was like, all right, so I know I'm gonna fucking piss in a cup today. If there's a problem, I'm sure she'll tell me, right? So if there's not a problem, I should assume that my pelvic pain and other issues are simply related to something else. That it's my typical pain because I am in pain every day, because I have chronic pain, chronic fatigue, chronic illness. I've been diagnosed with fibromyalgia, which is basically just doctor speak for we're not sure what's wrong with you, but your brain does seem to hate you, and your brain is deciding to tell you that you're in pain even though there's no physical cause for that. That's basically what the fibromyalgia diagnosis is. I'm not a doctor, don't take that literally, but that's essentially, you get diagnosed with fibromyalgia when they're like, we don't know what else could be going on here. You're in pain, and that's the only solution we can come up with. That's the only name we have for your set of symptoms with no test results being abnormal. So, I'm in pain every day. Every day. Every day I'm in some level of pain. On a good normal day, it's probably a 4. It doesn't usually go below a 4. Something always hurts. Something always hurts. It's either my head, my stomach, my back, sometimes my pelvis, my legs. Everything always hurts. And I deal with that. Currently, I don't have pain medication to help deal with that because I can't access it. So lately I've just been coping like, well, I'm going to be in extra pain because I don't have any treatment for this, because the treatments that I have tried before either don't work or make my other symptoms so much worse that it's not worth it. Like, frequently for fibromyalgia, you are given gabapentin. That is usually one of the first medications they try to give you to treat your pain. Funny enough, it's also used in the psych ward for anxiety sometimes, or panic attacks sometimes. That medication both doesn't relieve my pain. I have tried it. It does not relieve my pain, and it also just makes me even more tired and dizzy. I'm frequently dizzy. I'm frequently, like, not feeling well. I often feel like I have a cold or a flu, even though I don't. Like right now, my throat fucking hurts. My throat's been hurting for weeks now. That's just fibromyalgia. I just feel sick all the time. I'm in pain all the time. I'm exhausted all the time. And that's just part of my life. So I have to assume that if I go to the doctor, they take a urine sample, which they did, and they test it, which they should have, and I don't get a call back, I don't get, anything alarming back, I should be able to assume that, okay, it's not a UTI, I just feel bad. I just feel bad because I feel bad. I'm just having a flare-up because I have a flare-up, right? So that's the fucking issue when you have a chronic illness. That is the problem when you have chronic illness and chronic pain. Because you will be in pain no matter what. You will be hurting no matter what. You will be sore no matter what. You will be sick no matter what. You will be tired no matter what. And you have to determine, is this a new set of symptoms that I have to go to the doctor for? Is this something actually physically wrong with me that I need to go for? Or is this just a flare-up? That is the determination you have to make every fucking day that you wake up in pain. And it's hard to determine, right? What I'm feeling right now easily could just be I'm having a flare-up. I've been doing a lot. I walked around a lot over the weekend. That often leaves me feeling not great. It would make a lot of sense if this was just a normal flare-up. But I am having more, some of the symptoms are getting worse. I'm having more nausea than I usually do. I'm having more pelvic pain than I usually do. This is, this is gross, but we're talking about medical stuff. My urine smells like ammonia real bad, and that's not normal for me. So it's like, okay, maybe there's something wrong, but I also didn't get a call back from my gynecologist. So I have to assume probably I'm okay, right? Also another thing, my gynecologist, I did tell her that I was having pelvic pain. I told her that I was having those issues, and she was supposed to do a pap smear, which is typically what you go there for if you have a uterus and stuff. And she did not do that because she said, the reason she gave was kind of legit. Like, it was, I'm turning 30 this year, and apparently your pap smear is different when you turn 30. Like, they're checking for more shit when you turn 30, and that's less than 6 months away. So it's like, she was like, well, why don't we just wait and do it then? Because, I know you have sexual trauma, and that affects how that appointment goes. That affects how that procedure goes. After I have a pap smear every time, during it hurts a lot more than it should. It shouldn't hurt. For normal people who do not have issues, it should not hurt. And if it hurts, there's something wrong. I know what's wrong. I have trauma. That's what's wrong. So, that it was an attempt at kindness, right? Where she's like, okay, I know this traumatizes you. We can wait for it. Let's wait. I know, but it was also like, I was saying I was having pelvic pain, so perhaps should have done it anyway. I don't know. I'm not a doctor, right? That's the thing. I'm not a doctor. I have to both be an expert in my experience and also trust the providers that are in charge of my health, because I'm not a doctor. I cannot make those decisions. At the end of the day, I'm not the expert in the human body. I'm not an expert in the human body. But I have to balance that with being an expert in my own experience, which is, not the experience of a typical patient, a typical healthy patient who's coming in for an issue or getting a routine pap smear because that's just what you should do to maintain your gynecological health. So I called them today, and I'm like, hey, I just wanted to double check on the results of my urine test just in case. And they were like, oh, it didn't get tested. It didn't get tested. We didn't test your urine. We took a sample, and then we, I guess, threw it away. So that's fascinating, that they did that. Uh, so then I had to call and be like, okay, now what do I do? Because here's the thing. When antibiotics are, you know, antibiotics are fine. Like, I'm not gonna, there are some people who are like, you know, the, like, anti-vaxxers and stuff, or people who, you know, just don't believe in medicine in general, you know. I don't know what the fucking thing. Antibiotics are good. You need them. But there is also something now. Okay, to be clear, I'm not educated in this at all. Actually, I just know this is a thing. So do not take anything I say in this video. Don't take as medical advice, except maybe if you have a uterus, get your pap smear. That's the only medical advice that I'm qualified to offer as just a person in the world. That's just advice you should take from your nearby person. Whatever. I don't know. But other than that, this is not medical advice. I'm not a doctor. I am not a doctor. I'm not qualified in any way to speak on medical issues professionally at all. This is just what I know from having been to doctor's appointments repeatedly, constantly, and frequently since I was like 12, 13, 14. So yeah, everything, grain of salt, so many grains of salt, an entire can of salt, actually. They put salt in a can? I don't think so. So yeah. What was I saying? I lost track. Oh yeah, antibiotics are good, but there is a thing called antibiotic resistance where I don't know. Now the thing I don't know if this is a thing that can happen in an individual person or if this is something that is more of a concept of like through generations of people taking antibiotics, this is something we're concerned about. But I know that there's a thing of if you take too many antibiotics, there's a fear in the medical community of antibiotic resistance, which basically means that your body develops things that will fight back the antibiotics, so antibiotics don't work anymore. So basically, the fear is, again, this is not fear mongering. This is just a concept. Don't take this and run with it. Take your antibiotics. Please take your antibiotics. This is a concept that is if you are taking so many antibiotics all the time, like that it's like abnormal, right? This is supposed to be a freak thing that happens theoretically. Again, I don't even know if this is a thing that can happen within a person's life or if this is a concept that's like, if we keep taking antibiotics through the generations, then eventually a human will be born who has antibiotic resistance and therefore could die of a very normal infection because the antibiotics we use to treat it don't work anymore. So I don't know which it is. But also something that, if it is something that can happen in a person's lifetime to someone who has taken a lot of antibiotics, I have taken an insane number of antibiotics over the course of my life, often because I do end up needing 2 rounds for a lot of shit. I had a really bad infection this one time. I've told this story briefly in another video. I tripped over a pumpkin, and it was very funny. I tripped over it twice. And I guess a piece of it got like lodged underneath the toenail, and it was not good. I got cellulitis, really bad. Cellulitis is really bad. They were at one point like, if it's in the bone, because it was lasting for like months. It was like over a month, I think, that I had this infection. And cellulitis is a really bad infection. That's not just a normal infection. Like, oh, you just got a little thing on your toe. It was bad, real bad. They were like, if it's gotten into the bone, there's a chance we might have to amputate. And it was like, oh, good. So I was terrified of that for a while. It wasn't, thank God. But I think I needed 3 rounds of antibiotics. I think I was taking 2 antibiotics simultaneously, and that didn't work. And then they put a third, or it was the other way around where they tried 1, it didn't work, and then I had to take 2 simultaneously. I can't remember which it is. It was long enough ago that I just can't remember. But you know, and then recently over the past few months, I keep getting UTIs because I just do. I don't know why. I don't know. And some people are just more prone to them than others, apparently. Apparently that's the thing. And so it's like, this is like, you know, 3rd or 4th time within the past like few months where I've had one. And then it didn't respond to the antibiotic they gave me. So, you know, and again, this is one of those things where it's like, it's kind of no one's fault. It's kind of no one's fault because, whatever. Technically, everybody has done their job except for the gynecologist who should have tested my urine. Especially because I did say, hey, I have a UTI that I feel like I'm still having symptoms of. So yeah, okay. She didn't do her job, but the person at the urgent care technically did their job. It's just that, I don't know. The antibiotic they gave me was wrong, I guess, which can happen, because they're kind of guessing until the culture comes back and they can actually see what, it's week 2 or whatever. I don't know. Again, I'm not a doctor. This is just what I've gleaned from having these things happen a lot. So why am I so angry if everyone's done their job? Because I am infuriated by the fact that I have been in and out of doctors so much over the course of my life. And when you have been in and out of doctors so much, and you have complained of frequent pain that, they can't often find a cure for, or find a reason for, that shows up on your record, right? It shows up how frequently you've been going. It shows up when they open your file. It shows, the issues you've complained of in the past. It also, mine happens to have unspecified psychosis on there because of my episode in 2023. Now, there are also, I don't know, if you're a person who goes to a lot of doctors, you might know this. If you're not, this might seem weird to you. I am in multiple different doctor systems, right? So I have an online file. I have multiple files. I have multiple files with multiple different doctors. Certain doctors within the same network, some outside of the network. Because I go to who will take my insurance, and I go to who is, convenient, or sometimes somebody who's recommended, who might not be within the system, but they take my insurance, so I go. This means I have multiple different files that can theoretically say different things. They are supposed to communicate with each other, and they do frequently communicate with each other. However, my therapist, and as far as I know, my psychiatrist, have not diagnosed me with psychosis. I believe the diagnoses that we're working with right now is major depressive disorder with psychotic elements, which is different from psychosis. Psychotic elements simply means you have had some hallucinations in the past, mild hallucinations, nothing that's approaching something on the level of schizophrenia, where a person might, their hallucinations can deeply interfere with their understanding of their surroundings and their reality, which is a very serious thing. Also, those people aren't crazy either, and I'll get to that again in a second, because the term crazy is really starting to bother me, even though I say it to myself all the time. Anyway, and borderline personality disorder. Another thing that shows up when you go to the doctor, that you have a personality disorder. People who have personality disorders are considered problems. We are not treated humanely by the mental health system. I've talked about this in multiple videos. Borderline especially, although I believe probably NPD and some of the other ones probably get similar treatment, but borderline is uniquely mistreated often, especially because borderline is definitely a trauma diagnosis. It is a manifestation of trauma, and yet you are treated very differently when you have borderline, when you're diagnosed with borderline versus CPTSD or PTSD. You are treated with much less compassion and much less sympathy, because for some reason there is this kind of innate understanding amongst the medical community that somehow if you have a personality disorder, it is a disorder of yourself, right? It's not something that happened to you and that your brain has developed a way of coping that has been maladaptive, that has affected how you see things, right? They see it as a you problem almost. And borderline has been notoriously mistreated because we're seen as manipulative. People will expect us to try to manipulate. People will expect us to try to, lie or, deceive or, try to get what we want out of a situation, which is not how it works. That is not how borderline works. That is not what that is. A person, borderline is simply a diagnosis. It is a collection of symptoms that they have given a name to. I am still a person. I am still a human being. I still make my own choices. I still have my own rights and dignity that I deserve to be respected. I don't go into the doctor to try to manipulate and deceive, but they see psychosis and they see borderline, and they read that and they don't think that affects how they treat me. They don't think it does, but it does, because before I had those diagnoses, I was given a little more respect, maybe not a lot, because I am still an overweight AFAB person assigned female at birth, which, and complaining of issues and suffering from trauma, and also neurodivergent, which, those also create biases in how a doctor will evaluate you. But they see these scary diagnoses that they don't understand because they're not the doctor that assigned them, and they're not the doctor that treats those things. So they have limited understanding of them. They're treating my body and they don't understand that their understanding of my brain affects how they treat my body. I'm treated over and over again like I don't know my own experience and I don't know my own body. And that leads to medical gaslighting. That leads to them assuming that nothing is wrong and this is just another episode of me being crazy. They assume that this is just another instance of me not understanding my own body. And sometimes it is, because I am living in a reality where I am in pain all the time and I have to determine whether that pain is real or not. It is real. I have to determine whether it's something I need treatment for or it's normal. My blood tests have not been normal for a very long time. I have a high white blood cell count all the time for multiple reasons. There are other things that are wrong, There was a time where we were looking into, I was being tested to see if I have leukemia because my blood results were similar possibly to somebody who might have that or might be getting that. Not the exact same, but it was a concern, right? Like my blood tests were bad enough that it was a concern. I don't, by the way, we tested that. I don't. I have seen an oncologist for a few years because things were weird enough that they needed someone to check that out, right? And that's not just me complaining. That is a test that is done. Blood is drawn and they have those results. And they're not right. They're not normal. And I'm not enough of a doctor to know if they're not normal in a way that's like, well, it could be just, I don't know, you don't take care of yourself, because I think that's the assumption. Because of the weight I am and, the myriad of issues I have, there's this assumption that it's like, it's just because you don't take care of yourself. And it's like, well, what the fuck does that mean? I guarantee you that you watching, I probably eat very similar to how you do, okay? And I do not eat the healthiest, okay? I eat mac and cheese sometimes. I fucking eat I'm gonna have hot dogs for lunch, okay? Great, cool. Also, like, I eat a fair amount of oatmeal and eggs. I drink milk, it's like, I eat probably the same that you do. Probably a little different because I eat a lot less fast food, honestly. And I would wager that you probably eat a lot more fast food than I do. And yet, I'm treated like it's my fault, like I'm in pain. I'm treated like it's my fault because I'm not trying hard enough, because I can't afford to cook a meal every fucking day that has everything I need in it. I can't afford the ingredients. I can't fucking afford, all that shit, because, poverty does impact what you have access to in terms of healthy eating. Obesity, I hate to use that word, but in the greater, how they've, had to talk about it, obesity is often linked to poverty. Why? Because you don't have enough money to afford the healthy food that you need. You don't have enough money or time usually because you're either working so much or, a myriad of other reasons. You do not, you literally cannot, it is a privilege to be able to eat completely, cleanly, healthily all the time. And it takes a lot of work to do so. And, you know, could I be eating a little better? Yeah. Also, why are we saying that just because I don't eat perfectly and because I'm not the perfect ideal weight, that this pain that I'm experiencing, the high white blood cells, you know, the leukocytes, the fucking other shit, you know, that's abnormal, you know, does that have anything directly to do with my diet? I don't know. I mean, probably some, but like, you know, it's, they act like that's the only issue. And then, you know, clearly I'm not trying. Clearly I don't care about my health if I'm the weight I am. Clearly I don't care about my health if I'm coming in complaining of issue after issue and it's not changing, you know? And it's like, you know, yeah, there have been times I've gone to the hospital and nothing was wrong. How am I supposed to know? I'm in a, you know, 7 out of 10 pain. And, you know, now I've learned that if I'm at a 7 out of 10 pain, it's probably nothing. I just have to sit there and deal with it and cope with it. And that's supposed to not make me lose touch with reality a little bit, you know? God fucking forbid that being in that much pain ever alters your understanding of reality or your own body. If you don't live with constant pain, you don't know what it feels like. Because it's not just that it hurts. It's that it hurts and it hurts and it hurts. And you have to do other stuff and you have to think about things and you have to get shit done. I have to get up and make dinner and everything hurts and I have to stand up and it hurts. You know, and I've learned that crying about it does nothing except waste energy, the energy that I could be spending trying to cope with the fact that it hurts and that I still have things I have to do. I have to make a phone call and talk to someone while it hurts. I have to fucking do my taxes while it hurts. I have to fill out these forms while it hurts, you know? It's not just about pain, it's about the tax on your brain and your body. Because it always hurts, and you always have that in the back of your mind. And what do you do about that, you know? I actually have a lot of dissociation issues for a multitude of reasons. That's not just this reason, but, you know, my brain will just check out because I can't cope with the pain I'm in. And that has to do with both physical pain and psychological pain that I'm in constantly. And that's another thing. I'm also in a lot of psychological pain. Borderline is described as you know, it has some of the most emotional pain of any you know, psychological diagnosis. It is extremely emotionally painful, and emotional pain does matter. Psychological pain does matter. It does tax you. That's why when you have severe depression, you're tired all the time and you're struggling to do anything because you are in pain. You are in psychological pain that is putting, you know, pressure and weight on your ability to cope with life, and that's why you're sleeping all the time. That's why it's so hard to do anything. And, you know, we haven't been using terms to talk about it as a type of pain. I think that is a I don't want to say mistake, but a mistake of the mental health community is we have not talked about it in terms of pain, because it is a type of pain. It is a type of chronic pain. It is a psychological chronic pain that you are dealing with, you know, and borderline is very fucking painful. You get emotionally hurt, you know, very easily. You know, some of the again, I've talked a lot about this in other videos, but some of the prerequisites for borderline is just having a higher emotional sensitivity as a child. You just get hurt a lot easier. And, you know, people who are like, well, just toughen up. Just, you know, when you try to just toughen up, you develop a disorder. Because the pain you feel is real, you know? When you feel pain as a child, if you feel pain more intensely than other kids, emotionally, I'm talking emotionally specifically, that is a real experience for that child, and just telling them to toughen up and to, you know, handle it better does not address the fact that they are in real pain, and it does not validate the fact that they are in real pain, and that pain is significant. You know, and if they grow up in a world that just tells them to just, you know, stop crying, stop feeling that, stop feeling your emotions, stop being hurt by stuff that shouldn't hurt, it doesn't fix it. It doesn't make you a tougher person. It does not. You develop something. You develop a disorder of some kind, and often it's borderline. Because borderline also it develops through chronic invalidation of your experience. Because, your experience is real, What you go through is real. What you feel is real. Even when you're a child who can't maybe explain how you're feeling, or you can't understand all the levels of what you're feeling. You don't know why it hurts, but it hurts. And then people invalidate that, and then you learn to invalidate yourself. And funny enough, your brain just doesn't develop normally after that. It doesn't. Every time you are invalidated, it is a micro-trauma. It is a micro-trauma that builds up and builds up and builds up. And when you are constantly invalidated, when you are always told that your pain is wrong, that your understanding of your pain is wrong, that your way that you are handling your pain, the way you are interacting and interfacing with your pain is wrong, then you just learn that you are wrong, and your feelings are wrong, and your experience is wrong. And then they call you crazy, and then they call you psychotic. And there is nothing wrong with psychosis, man. It's also, why does a diagnosis of psychosis mean that I am less entitled to treatment? Why does it, I understand that a patient who is detached from reality for one reason or another, they might be describing their pain in a way that does not make sense for the reality of the doctor, because they do not have the language to explain it, right? They are experiencing a disconnect from reality. And again, I'm not a doctor. I don't know how it affects the brain exactly. But I do know psychotic patients. I have met psychotic patients. I have met other patients in the hospital who are experiencing detachments of reality, who do not know the room they're in, who are seeing things that aren't there. I've been with those patients, and you know what? They're humans too. They're humans who also deserve to have relief from their pain. They're humans who also deserve to be treated like human beings instead of like animals, which is how I feel like we are treated. I feel like as soon as you're crazy, you are treated like you don't understand anything, even though, I have had mild hallucinations over the years, and other therapists have just said it was due to stress, that it's severe stress. The major depressive disorder with psychotic elements is largely, it's because you are under so much stress and you've had major depression for so long that it's starting to alter your brain. It's starting to alter how you see the world, because it is so much stress and cortisol and other chemicals I don't have names for, just like putting pressure on your life and your perception. Sometimes I hear, someone crying when there is no one crying. Sometimes, I don't know. That's the most frequent one I get, is I hear crying when there is no crying. Or another weird one I get is, if I hear the fan going, my brain interprets it as screaming sometimes, so, these are the things that it's like, oh, you're just, you don't understand your own reality, You've listened to me talk this video. Do I sound like I understand my own reality? Do I sound like I understand the world I live in? Does it sound like those hallucinations are impacting my own ability to say, hey, something hurts, I'm in pain? Because I think I sound rational, Just because I've had a disconnect with reality sometimes, does that mean I have lost the ability to be rational? I have 15 minutes to explain myself to you as a doctor, and you're going to take what other doctors say way more seriously than you're going to take me seriously. I have 15 minutes to explain myself, and you have an entire file that tells you not to trust me. And what happens if something is wrong and you don't believe me? There are patients who are so mistreated by the medical system, and I don't think this is the case for me. I will say this. I don't think that this particular issue is the case for me, but there have been patients who have complained of issues for so long, who have been, fat like me, or AFAB, or, unlike me, black. Black women are often the most mistreated demographic in the system, aside from like mental illness and stuff, just as far as like person-to-person demographic. But, all women, I'm not a woman, I am a man, I'm a trans man. And, I don't know the studies on how trans people are treated in the medical system, but I would guess it's not well either. I'm AFAB, but I'm a trans man. And, that will affect how they treat me, whether they realize it or not. Um, you know, the AFAB body is just not understood as well as the AMAB body, assigned male at birth. You know, women have chronically been mistreated by the medical society, medical communities, and the entire conversation around abortion is proof of that enough. People barely understand pregnancy enough. There's some people who just straight up, believe that the fetus has more rights than the woman holding it, or the person with a uterus holding it, because it is not always a woman who is holding the child, but. And then also being large, being fat. I am fat. I'm enormous. I'm very heavy. I'm very, very heavy. And a doctor likes to look at that as proof that I don't care, as proof that I don't eat well. I eat, it's not, and I do want to actually, I should step back from some of the language I'm using, because I don't want to encourage fat phobia. I think that is a very big issue that some of my language today has played into. And I know some of my views of myself have played into. There should be no morality around eating. There should be no morality around the food you eat. So saying eating better or eating worse, I actually don't like how I'm saying that. And I think that kind of language actually does contribute to the exact issue I'm complaining of. So I'm going to try to fix that a little bit. But like, my sister, you've seen her in a couple videos, and this is not a body comparison or shaming thing. She struggles with the opposite thing of getting enough nutrients, eating enough. She eats a lot more fast food because she works a lot. And yet the average person will just assume she eats better than me, eats healthier than me. And again, this is not a morality thing. This is, talking about just like society's view of me and my sister. When they compare our bodies, they will immediately assume I am the unhealthier one, in terms of how I eat, because of just, and because she works so much, she's unable to cook as much as she would like to, and that's, she's under so much stress that, she has to rely on fast food to get her food. So it's like, food has been kind of weaponized against us. We go to the doctor and they just assume you're not eating right. You're complaining because you're not eating right. You're complaining because you're not exercising right. Whereas someone who is healthier, who doesn't go to the doctor, might eat so much worse than either of us do. Worse, again, I'm literally using the same language I just said I didn't want to. It's really hard to divorce a harmful language. And, I talk a lot in videos about, trying to be kind and compassionate with your language. And even I mess up. Even I struggle sometimes with certain language that I use. Calling myself crazy is not helpful, and also contributes more to the idea that I'm trying to argue against, that, crazy invalidates, your understanding of yourself, or crazy invalidates, your experience as a human being, when I don't want to give that message at all. Again, I have met people that society would call crazy, and some of them have been some of the most wonderful people I've ever met. It doesn't matter what reality you live in, you can still choose to be a kind person. You can still choose to be a compassionate person. And, being crazy or not shouldn't matter. And it's so frustrating. It's so frustrating that the main problem is just I'm not able to explain my experience in a way that they can understand in those 15 minutes, I'm taking however long I'm taking in this video. I don't know, it's probably going to be around an hour by the time I finish, because that's usually how long these things go. I'm taking an hour to explain to you what's wrong. I can't do that to a doctor. I can't just bring that in. They do not have the time. They are overbooked, overworked. They see however many patients a day. Again, for like 15 minutes, 30 minutes maybe. An hour if you're lucky, if they're doing something really intensive, but not very often. Usually that's just reserved for your therapist. Your therapist, who usually does not just prescribe medications, who does not, even your psychiatrist. You see your psychiatrist. Most of my visits with my psychiatrist are like 10 minutes, 10, 15 minutes. And they're the ones giving me medication, whereas my therapist gets an hour of my time. And in theory, they're supposed to communicate with each other, but then sometimes the therapist is like, well, I don't know medication, so rely on your psychiatrist. It's like, yes, but you also have a fuller understanding of my experience. Can't you go to bat for me a little bit? Can't you trust that you also have a better understanding of me than my psychiatrist is going to, because I see my psychiatrist for such a short time, and they're making determinations about my whole fucking life. And it's just been, this medical fucking gaslighting. I've had issues repeatedly over the course of my life. We always go in and we test and something's wrong, and then we don't know. I've been in and out of the hospital for reasons. And then I've had some things that have been very weird. For years, I was diagnosed with ulcerative colitis, which is something that they, do a colonoscopy for, and then they take a biopsy, and then they go, yes, this is ulcerative colitis. For years, that was the diagnosis, and they did repeated colonoscopies. This was when I was a teenager, and they always found the same issue, and then suddenly when I was an adult, they did those tests again and did not find anything. So that diagnosis was removed, even though that is not something that can be cured. Ulcerative colitis never goes away. If you have that, it's not something that can be cured. It's not something that can be taken from you. It's not something that can be cured or healed. So where did it go? No, none of my doctors care, right? They look again and they're like, oh, must be nothing, And no one is asking the question, well, why was it showing up as that for so many years? Why, for years and through different doctors? It wasn't just one doctor who did that and maybe made a mistake. I had multiple doctors confirm that diagnosis for years, and suddenly it's not there anymore. Aren't we curious about that? Aren't we fucking a little bit like, why did that happen? Why? That doesn't make sense, especially since I have been complaining of so many other things, especially since I have been having symptoms. I always have symptoms. I always have something wrong. I'm always fucking nauseous. I'm always fucking shitting myself to death. I'm always fucking pissing myself to death. I'm always fucking doing something, It's gross. Yeah, this is, what do you expect? This is a medical fucking video, okay? And then I'm just apparently a hypochondriac, because I keep going in and they can't find anything. And then I get the diagnosis of fibromyalgia, which is basically them just saying, we don't know. We don't know. This is the only thing we can say. You're just in pain, and I guess that's it. And it's like, okay. And I dropped off what I was saying earlier. Circling back around to that is, I was saying there have been times where people like me, in my demographic of large AFAB, any myriad of other things contributing to why a doctor, treats you like an animal. And they've had things that have been missed for a long time. My exes knew someone who she was going in time and time again. She was large. She was fat. She went in time and time again complaining of issues of back pain, abnormal back pain. And they kept saying, lose weight, lose weight, lose weight. She couldn't. She was very sick. And then it turned out she had cancer, and she died. She passed away from the cancer because they didn't catch it until it was way too late, because she was complaining again and again and again and again of back pain. And they look at you when you're fat and they say, you have back pain. Well, yeah, of course you have back pain, you lardo. You're carrying around so much fucking weight. And they're a doctor. They should be able to have a nuanced look on it. They should assume that we know that we're heavy. We know that, if you live in a heavy body, the things that come with that, right? If I'm complaining of back pain, it is abnormal back pain. If I'm complaining of back pain, it's because it is something different from the pain I'm getting from just carrying my weight around. Which also, the assumption that you must be in pain because you're overweight, because you're carrying weight around, I don't even know how legit that is. How many large people out there are not having that kind of issue, Or, you go in complaining of shoulder pain. It's like, well, it's because you're fat. It's like, well, how does that make sense? What am I carrying from my shoulder? Like, they use it as a cop-out. And then, if you keep complaining, it's like, well, why are you complaining? You didn't lose weight. you're not healthy enough for me to consider, that maybe there is something wrong, And sometimes they're right. Sometimes it is my weight. Sometimes I'm not, it is nuanced, right? This is a nuanced conversation. Sometimes there are some things that are because of my weight. There are certain aspects of my pain and my experience that I do know is because of weight. I mean, even when I was a teenager and I was not heavy, I was very, very normal, average weight as a teenager. I didn't gain weight until I was an adult. But I always had a big chest. I always had a very heavy chest, triple D in high school. And when I did ballet, I would get excessive back pain because I'm carrying fucking heavy tits around. And that's, you're doing all these kinds of bending and moving, and it's not ideal for that kind of movement. So I was struggling with back pain a lot then too. So I'm aware that, carrying more on you does affect things. It does affect your pain. It does affect, especially if you've already got fibromyalgia. But also we don't understand fat bodies as much as we think we do because doctors refuse to investigate. Doctors refuse to treat it as a valid body type to treat. They see being fat as a problem instead of this is my body type. Treat my body type. Treat me, Yes, I'm fat. I also still occupy this body. I still, have the same fucking organs everyone else does, I've still got shit that needs treated. Treat me. Don't fucking treat, this thing that you've dehumanized, this thing you've demonized, Being fat should not mean I'm not allowed to be treated like the next patient, And it is frustrating that it's nuanced because I have had chronic pain issues, because I have had chronic illness issues. So yes, I have gone into the doctor and there's been nothing wrong before. And it's just like, yeah, I'm just in pain because it's fibromyalgia, because I'm always in pain, because I'm always going to be in pain. And somehow I'm supposed to cope with that completely normally. I'm supposed to just, that's not supposed to cause me any kind of fucking distress or fucking issues. And why can't you have compassion on the fact that I'm in so much pain? And even if I'm not understanding, my symptoms right, even if I am wrong about my symptoms, why can't you treat me with compassion first? Why are you treating me with dismissal first? Why are you treating me with wariness first? Because you see these diagnoses of psychosis and a personality disorder, and you're immediately wary of anything I'm going to say. I sent a message to my doctor about the fact that, hey, my therapist has not diagnosed me with psychosis, by the way. My therapist has diagnosed me with major depressive disorder with psychotic features. I didn't get a message back. I saw the doctor afterwards and nothing happened. And it's like, so you're just going to ignore that message. That doesn't matter apparently. You don't trust me, I guess. You trust this other doctor who isn't my therapist who gave me that diagnosis. I don't even know what doctor put that in the system. I don't know which one did it, but, I'm not treated humanely, and people die from not being treated humanely by doctors, And I'm not saying that's what's going to happen. A lot of that is my anxiety, right? Like, I know there's a lot of it's my anxiety. There have been times I've been worried, like, do I have cancer? And they haven't found it yet. I have this fucking hump on my neck. You can't see in this video, and I can't fucking show it because of how my clothing is sitting. But you can see in some videos that, I've got this weird fucking hump on my back that, wasn't there for a long time. It's only been something that's appeared in the past, few years. And, my fucking pet theory is it's from the fucking cortisol, because that can be a thing, is that cortisol builds up and creates that. I don't have proof of that. I also don't know why else it would be there. But I'm not a doctor, so that's not like a diagnosis thing. I'm not saying that that's definitely what it is, but cortisol is the stress hormone, and I have been under so much fucking stress. I have untreated trauma from events that have happened in the past several years that have permanently altered me and permanently altered my ability to feel safe and to, sleep at night and, engage with my body in a healthy and normal way. And that's not being treated either. You know, I explained that to a doctor, and that's not something they put on the record. They don't, you know, that's just, you know, that's shit you just got to deal with on your own. You know, it doesn't matter what's happened to you. You know, it doesn't matter if you've been violated in any way that is gonna fucking alter your own safety and stress response. And, you know, it doesn't fucking matter what's happened to you. You know, you're just crazy. You're just crazy. You know, that's all that's happening, is you're just fucking crazy. And so what am I supposed to do? You know, I have nobody on my side, you know. You know, my parents are a little bit on my side, but I can't bring them into doctor's appointments because the fact that I'm trans comes up, and that affects how my parents will treat me. And they will not back me on those things. So, you know, while my mother is sympathetic to a lot of my pain, and she's sympathetic to, you know, the fact that, you know, I'm suffering, and she wants to help and she wants to advocate for me sometimes, you know, selectively, it's also like, I can't bring you in because you don't believe in my identity. You don't believe that I'm your son, you know? So I can't bring you because you're going to invalidate other very real parts of my identity in trying to help me. You know, who can I bring? Nobody. I don't have anybody to bring. I don't have a partner I can bring in. I don't have a friend that can come with me. I don't have a friend close enough to me that could do that. So what do I do, you know? The doctor doesn't listen to me, what do I do? And, you know, now I'm in such a position that I can, you know, have a UTI for weeks, which is dangerous. You know, if you have an infection that is untreated, it's dangerous. It can spread, it can worsen. You know, people do still die from infections nowadays. You know, the only reason we don't is because of the invention of antibiotics. But if you don't get an antibiotic, you will still die from that infection. And so it is dangerous to just walk around with an untreated infection, which I have been doing for the past who knows how long. Because I'm like, well, I'm always in pain, so this must just be normal pain, right? What else am I supposed to think? They were supposed to catch it. I took my antibiotic. I'm still in pain. All I can deduce is, okay, this must be my normal pain, until today, where it's like, this is worsening to a point where I guess it's not my normal pain. I guess this isn't my normal pain. I guess this is something weird. You know, why am I less deserving of being treated like a person, you know? Just because I lost contact with reality for a bit. And I don't even think that's what happened, honestly. I don't think it was psychosis, man. The thing is during that hospital visit, I knew where I was the entire time. I told them where I was the entire time. I knew what was happening, and I knew where I was the entire fucking time. And they called my interpretation of that experience psychosis. Do I listen because I don't know my own experience, or do I know my own experience enough that it wasn't that, you know? And that's the frustrating thing, is I've been struggling to put into words what my experience was in that, because I don't think it was psychosis, you know? It's something I've thought about a lot, and I've been trying to listen to the doctors when that's the thing, is when they first said it was psychosis, I was like, all right, fine, it's you know, or not first, but, you know, after a while I was like, well, maybe it is, because I'm trying to be compliant. I'm trying to be compliant with my treatment. I'm trying to listen, right? It doesn't help if I'm not listening. It doesn't help if they're telling me to do something and I'm not listening. I get that. But what if they're wrong and I'm trying to, you know, what's the difference between I need to advocate for myself because you're wrong versus I'm just being non-compliant? Because that's what I've been called. That's what I was called there, that I was non-compliant because I wasn't willing to take a medication that I knew wasn't right for my situation. And then I took that medication and it had effects on my body that were negative. You know, they held me down and forced me to take a medication that I said I was not comfortable taking. I said, I'm not comfortable taking this medication, and they forced me to. You can legally deny a medication in the psych ward. You can do that. And I tried, and they did not let me, because the doctor determined that I was not capable of understanding myself, that I was not capable of understanding my reality. And I do have compassion for that doctor, because he was trying to navigate a situation with a person he's never met, who is, a lot of people do come in saying this is what's happening, and it's they are experiencing some kind of detachment from reality that needs to be treated. So I do have compassion for him, and what is he supposed to do, right? My reality is apparently not matching up with the reality of the people observing me. Okay, all right, what is he supposed to do? I do have a certain level of compassion for that. He was trying to make the best decisions he could at the time. Also, the fact is that, there are other words for my experience that I can't find, because sometimes I struggle to put certain things into words. I struggle to communicate things. I can communicate very well in some ways, and then in other ways I can't. I struggle to understand things sometimes because I'm neurodivergent. Autism, I've not been diagnosed with autism, but I have grown up around it. I've seen it a lot, and multiple other adults who have treated autism have seen it in me and said I should get treated, which, by the way, I did try to go to get treated or diagnosed with autism. I saw the doctor. He wouldn't even test me because he said there's no way. There's no way. He just looked at me and said there's no way. So he wouldn't treat me. How is that okay? I have been diagnosed with ADHD, and often the two coexist. I think it's fair to say I have autism. And there are a lot of people who do self-diagnose with autism because it is something that is so overlooked, especially in AFAB people. People assigned female at birth, it gets missed a lot for whatever reason. I have theories on that too, but whatever. But I have grown up around autism enough. Again, my sister has it, and it's prevalent in our family. And I, went to school with many autistic children, and I've grown up around it, and I don't think it's fucking just self-diagnosing to say, it is self-diagnosing, but I don't think it's, crazy to say that I have autism. And autism does affect your understanding of things. It does affect your ability to communicate, There's a lot we don't understand about autism. There's a lot we do understand about autism. But the thing about autism is it affects everybody in different ways. Every single person who has it, it affects them in a different way. There's not one universal example of autism to look to. And it affects how I communicate. It affects how I understand the world. And I think a lot of what happened in the hospital is largely due to my autistic understanding of the world and my autistic view, because it does affect how you view the world, because it's how your brain works. If you're neurodivergent, your brain works differently. It works differently to somebody who is neurotypical. And that is not taken into account when we are evaluating my mental health. The fact that I am viewing the world in a different way, that is just as valid, because there's nothing wrong with being neurodivergent, and you are not crazy if you are neurodivergent. You're not insane if you're neurodivergent. You're not insane ever. We shouldn't fucking be using that word anymore. But, it's a word that gets used. It's I sound very coherent. I sound intelligent. And also, I struggle to understand certain aspects of my experience because, autism does affect how you see the world. It does affect how you view things. It affects how you communicate a lot of times. I think that's something that we don't talk about enough, is that, we do talk about it. There are a lot of autistic people who are nonverbal, or who have a limited ability to communicate. That is very much seen. And somebody would look at me and say, I have no difficulty with communicating. If you're watching this video, you would assume I have no difficulty communicating in any way, because I sound... That's the danger of my experience, is I have to sound like I know what I'm talking about, because if I don't, I'm mistreated. But then if I am struggling to communicate something to you, if I'm struggling to communicate to a doctor, they can't pick up on that, they can't know that, and so they just assume I'm crazy. I've always said language and communication is about being understood. The point of language is to be understood. The point of communication is to be understood. It doesn't matter what you're saying. It doesn't matter how you're saying it. What matters is what the other person hears, right? It doesn't matter what you say, it matters what the person hears. You can talk all day, you can fucking say anything, and if the other person can't understand you, it doesn't fucking matter. You're not communicating, you're not using language. not in the way it's intended to be used. It's not about the fucking rules of grammar. It's not about how you are saying it. It is about what is being understood. And so that's what I focus on when I am talking to someone. I focus on what can they understand? What can they understand from what I am saying? And I focus on it to a point that I talk differently to every person that I interact with. Because, everybody speaks differently. If you pay attention, everybody has different things they understand, different ways of speech that they use. It's a complicated thing, but, I can only speak in a way that the person can understand. And that limits my vocabulary sometimes, because if I don't believe that you can understand me, I can't say it. There are words I can't say to you because I don't believe you will understand or believe me. Words that describe my experience that I cannot say, that are cut from my tongue. Because that's how my brain works for some reason. So I have to speak around it. I have to talk around it in ways that you can understand. I have to use language you can understand, that I know you can understand. And when I go to a doctor, that means that sometimes I can't talk. I can't say what I'm trying to say. I can't say what I need to say. And nobody can help me with that because I can't communicate it. And even that, I'm not even sure if that's the right way to explain it, but it's the words I have right now. It's the only words I fucking have, man. I'm both an excellent communicator and a terrible communicator at the same fucking time, and it's really fucking terrible. I fucking hate it. But again, the onus can't all be on me, It's a two-way street. If I've been talking to a doctor for years and I feel like they won't understand me or believe my experience, that probably comes from something. It probably comes from the interactions we've had, right? If I don't feel safe, if I don't feel like I can trust them. Communication is always about being understood. That's what it's about. People deserve to be spoken to in a way they can understand. That's just a basic human right that we all have. We all should have, anyway. People should be spoken to in a way they can understand. And the most frustrating thing is, if there's something I'm not understanding, I don't even know how to ask for clarification sometimes. This is kind of diverting a little bit from what I was originally talking about, but it's like, the frustrating thing, to be able to ask for help, you have to know what help you need. You can't just say, I need help, because then they say, what do you need? You have to be able to answer that question to get any kind of help. Sometimes I say no because even though I do need help, I don't know what help you can give me, I don't know what help you can offer me. I don't know what help I need that you can reasonably accommodate. So I say no. And I wish I hadn't said no, but my mouth says it before I'm able to stop it. I can't, it feels like sometimes I can't even, this is not the right way to say it, but it feels like sometimes I can't even control what I'm saying. That's not at all true or the way to say it, but I don't know how else to word it right now. If you don't understand something, you have to be able to describe what you don't understand. And if you don't understand it, then how, that's the really infuriating thing, when you don't understand so much that you don't even know what you don't understand. How can you ask for clarification when you don't even know what clarification you need, because you're starting from such a level of not understanding that you can't even verbalize what you don't understand? That's the tricky thing. To ask for help, you have to know what kind of help you need. You have to know what you don't understand. You have to know what you need from the other person. And if you can't say that, then how can anyone help you? How can anyone do anything for you? That's a scary thing. There's nothing more terrifying to me than someone not being able to communicate. That is, it's one of the biggest things that I get scared of with children and animals a lot of times is, because children when they're super young can't always communicate correctly or the right way, or They don't always know what's wrong. And you know, I know when I was with my exes, you know, and we were taking care of the kids, you know, that was something that would distress me a lot when the kid was crying and I couldn't tell what was wrong and they couldn't communicate what was wrong. And it causes a lot of panic in me to see someone in distress who can't communicate what's wrong. It's deeply terrifying to me. And I always try to, you know, I'm always trying to figure it out. I'm always trying to find out what's wrong. You know, because the idea of being someone who is in pain and cannot communicate in any way to get the help they need, that is fucking terrifying. That's terrifying. One of the scariest stories I ever read in my life was I Have No Mouth and I Must Scream, which I won't spoil that. And if you are squeamish in any way to anything, don't read that. It's a terrifying short story. Probably the most terrifying story I've ever read in my life. You know, and it's, I don't know, you can probably guess from the title why it's so scary to me. And it's also the thing, you know, taking care of my dog and other dogs, other animals. You know, when animals are in pain, they obviously can't speak to us. You have to interpret that they're in pain. You have to be able to detect it as their caretaker. And it terrifies me when an animal is in pain, or when they're, you know, barking or making noise that I don't understand. You know, it scares me because I'm like, you know, if they're in pain, they can't communicate it, and I have to figure it out. I have to figure out what hurts, you know. They can't tell me their stomach hurts. They can't tell me their leg hurts. You know, I have to pay attention. Are they limping? You know, are they vomiting? Are they going to the bathroom weird? You know, that's what you have to do. And the idea that an animal could be in pain that I don't understand or can't figure out terrifies me. This is way off topic. I don't even know why I'm talking about this, man, but, you know, my exes and I used to joke that it was really good that I missed the infant years of the kids, because I met them when the youngest was 3, I think, and we would joke that it was really good I missed the infant years when they really can't talk or communicate. You know, you really gotta do guesswork then. You know, you just gotta hear them cry and be like, well, something's wrong, and you hope it's just that they're hungry or tired or something. You know, I don't know. I have a lot of anxiety around that, you know. It's the most horrifying concept in the world to me that somebody could be sorry. It's the most horrifying concept in the world to me that someone could be in indescribable pain and not be able to communicate it, not be able to get help for it. Because I feel like that has been my experience. You know, I was a kid trying to communicate that I was in pain, and I could never communicate it in a way that anyone could understand. And so I eventually just decided maybe I'm not in pain, maybe it's all in my head. You know? Maybe my pain isn't real. Maybe it's not real. If everyone around me is telling me my pain isn't real, maybe it's not real. And now I'm sick, you know? You know, that pain didn't go away. It festered and grew, and my body has suffered for it. My brain has suffered for it. My heart has suffered for it. You know, and it still feels like people don't believe me. And that's not entirely true. Some of that is a fear, some of that is a feeling, some of that is not real. Some of that comes from something deeper that needs to be treated by what I don't know. But, you know, I developed the way I talk because I was so chronically invalidated as a child, because I was so chronically told nothing's wrong. And so I would come back and to the adult figures in my life. I would come back again and again trying to explain my pain in a way they could understand, always having a new way to explain it. And what that was seen as is stories, you know, making shit up, or it was seen as, you know, sometimes it was seen as lying, because I was explaining it in the only words I had at the time. I was explaining it in the only way I could understand at the time. And because I was young, because I was a child, sometimes that way of understanding was incorrect. Sometimes I didn't have the language for the pain I was in. Not language that could be understood by the adults and the caretakers in my life. You know? And that creates a cycle of invalidation. and validation of pain that is very real and very constant and does not go away and festers and grows and becomes something else. And now I'm sick. Now I'm deeply fucking sick. I'm deeply fucking sick because that pain never went away. It just grew into different forms, you know? I'm incredibly sensitive to stress. Whenever I have any kind of stress, it shows up in my body. You know, I flare up with sores. I flare up with rashes. You know, I get sick. I get you know, I get a flu. I get a cold. That's not a flu or a cold. You know, I get headaches. I get headaches when I'm, you know, under certain types of stress. You know, nausea, stuff like that. I have this weird issue where I hardly ever throw up, but I'm nauseous all the time. You know, I both have a very strong stomach and a weak stomach at the same time because I hardly ever actually vomit. Excuse me, God. But I hardly ever actually vomit, but I'm very nauseous all the time. You know, it's I don't know. You know, it's just, you know, how much is psychosomatic? How much is just because I've been under such severe stress my entire fucking life, you know? And yet, you know, they won't treat that stress, you know? And that's why it's been so difficult to not have access to my medical marijuana, because that does treat the stress, you know? I do notice my, you know, my sores clear up. You know, a lot of my symptoms go down because it helps treat the stress, which helps treat the pain, you know, which helps me live a humane existence, right? You know, and other meds don't treat it the same way. Because I have tried other pain medications. I've tried a lot of them. I don't know. It makes me feel like I'm crazy. It makes me feel like an animal. It really does. It really fucking does. You know? I feel like I'm, you know, I must not be human because clearly you are showing me that I don't deserve to be treated as one, you know? You know, I say things and they just go in one ear and out the other, you know, bounce off. And, you know, I developed the way I speak to be extremely meticulous, you know, because, you know, I worked so hard, you know, from when I was little. I don't know if this story will make sense, but when I was very young, like in like kindergarten or first grade, I think I was in first grade, I told my classmates, I don't know if you've ever read the book A Little Princess. I really liked that book when I was little. It's a little girl who's just goes through all the worst shit. Like, she just has the worst fucking life, man. Worst fucking life. And there's a period of time in the book where she is locked in a dark attic, and is not fed, and is not, it is, I forget if she's beaten or not. I think she's beaten. I don't remember. She's severely mistreated. And that isn't literally what was happening to me as a child. That is not literally what was happening, but it was the only way I could explain something else that was going on that I couldn't put into words. And so I told my classmates that I had that experience because I was using the scene in the story to try to explain something about my life and my experience that I didn't have any other words to put in, because I was in extreme pain. I was in extreme pain and I couldn't put a word to it. I couldn't name it because I didn't have the name for it. I didn't have the words for it. And unfortunately, a teacher got told, and then my parents got told, and my parents were like, you just told the class that we were abusing you, and we could go to jail for that. And I was like, that's not what I was intending to say. You know, I was little, and it was, you know, and it was like, okay, well, that clearly wasn't the right way to explain that I'm in pain. You know, and so I was like, that's not what you know, I don't want my parents to fucking go to prison or anything, so I'm gonna fucking try to explain this in a different way. And that's what I would do over and over again, is I would come back with a different explanation, and it was seen as lying. But what I was trying to do was I was trying to explain the pain I was in a way that people could understand, because I didn't have the words for it. And of course it looks like lying. It looks like I was just making shit up. I do not lie. I do not like lying. I don't try to deceive, because it is so hard for people to believe me. Why would I spend energy trying to deceive you? You know? That doesn't fucking make sense. If my primary goal is to be believed about my real fucking experience, where does lying get me? Nowhere. It doesn't get me fucking anywhere. There's no fucking point for me to lie. There's no point for me to fucking lie. But sometimes I'm wrong when I explain it. Sometimes I try to explain it and I can't understand what I can't put it in words that make sense for other people, because I think a lot of times in concepts strung together that is not directly easy to communicate. I don't know. Again, even these words don't feel right. That's the problem, is I try to explain and it still doesn't feel right, and it's so frustrating. And then I have the same problem at the doctor. You know, I'm having the stress show up in my body. I'm exhibiting symptoms. I'm feeling sick. I'm chronically ill. I'm in chronic pain. Am I lying about that? No. You know, but I don't know what other words to use to explain to you that I'm in pain, you know? And I've been trying so hard to explain that I'm in pain, that it's showing up in my body in ways that they can't understand, that they can't treat right, you know? And even my therapist does not believe I'm neurodivergent. But I don't know why, and it's very, very frustrating. Someone didn't do their paperwork is what happened. What happened was I was being treated for ADHD for a long time, and she didn't document that for some reason. She was treating me for it, and she just never documented it. So I don't know what happened there. So, you know, and I do believe I'm autistic. I do believe that my understanding of the world is heavily affected by an autistic viewpoint, and you know, I've had to understand the world in a different way because it doesn't make sense to me the same way it does to neurotypical people. I just see the world differently. I understand the world differently, and that's part of autism. My experience of the world is different, and then they call it psychosis, you know? They call that, you know, that I'm crazy. You know? And neurodivergent people are mistreated, you know? They are. Because they are seen as crazy, or they're seen as, you know, how can your shirt hurt you? You know, it's a shirt. There's a tag on the shirt. Why? How could that possibly be causing you so much distress that you have to cut the tag off, or that, you know, how could the lights possibly be so bright and so loud that you need to leave the room? Why are you melting down because there was a loud noise? That, you know, of course, you know, everybody in the room got scared by the loud noise. Why are you having a crying fit over this loud noise? It's because the understanding and experience is different. The sensory experience is different. You know, the very basic way we take in the world is different. And we are mistreated, you know. I can't even, you know, get access to a diagnosis because, you know, my doctors won't even take me seriously enough to even treat that as a possibility. Because I'm crazy. Because I've come to them so many times with pain that I'm like, no, I don't know why this hurts. I don't know why this hurts, you know? But it hurts, and you're the doctor. You're supposed to treat me. You're supposed to take that pain and find a solution for it. That's not my job. That's your job. And then when I bring up, like, you know, I don't know. It's been deeply frustrating. Been deeply fucking frustrating. And now I hate going to the doctor now, man. I don't like going to the doctor, and I'm kind of frustrated that it's like, you know, even just pursuing transitioning, you know, it's more doctors and more blood tests, and I'm excited about transitioning. I'm excited about that aspect of my care, but also it's just, you know, I'm so sick of the medical system. I would love it if I never had to see another fucking doctor again. And hopefully that's not a fucking, I don't know, I'm not gonna say that, but I don't know. You know, what am I supposed to think? I'm not a doctor. I'm doing my best. I'm doing my best to express my pain in a way that you can understand, and clearly, you know, we're not able to come up with a solution for it. So what am I supposed to do? Who am I supposed to go to? You're the doctor. Who am I supposed to go to? What am I supposed to do? I've been trying to listen. I've been trying to do what is asked of me, you know? I don't know. I don't know. And I'm not perfect. I'm not perfect, you know. I'm not perfect. Sometimes you know, I get told to do something and then I struggle to keep up with the medication or something because I'm, you know, struggling to do basic things. I've been trying to clean my fucking apartment for so long because it needs cleaned really bad and I've just been having such a hard time doing it. I mean, partially, you know, right now I have an infection, so, or I likely have an infection. I don't know. Technically, I don't know it, but, you know, I don't know. I don't know what's going on. I don't know what's wrong with me. I don't know what's going on. And I feel crazy, you know. You know, the way that, you know, looking back on, you know, I said I was, you know, I was this little girl in a dark room, you know. I feel like that was my way of explaining dysphoria at the time. You know, because those were the pieces that I took away when I was re-explaining it. What I said, you know, the scenes in the book were one thing, but what I told them, I said, you know, it's, you know, I'm a girl locked in a dark room, you know, and I you know, I wonder if that was the only way I could explain my dysphoria at the time, you know, kind of trapped in this darkness, you know. I've kind of felt like that, like I'm this little girl trapped in this darkness, and I'm not a girl, but, you know, those were the only words I could explain at the time. I read that story and I was like, that's me. I feel that. That is my reality in the best way that I can put into words. I don't know how else to put this into words because I do not have the words for this. I do not have the words for this type of pain. I do not have the language for this type of pain because I'm like 6 or something, you know? And that is one of the reasons media has been so important to me, because even if people don't believe me, it's helped me understand myself in a way, and it's a convoluted way to try to understand my own reality. But, you know, it's the only way I've been able to, is seeing myself reflected in media and art and stories and stuff, you know. You know, I've been able to find myself more through the art I've engaged with, through the media I've engaged with, through the stories I've read. I've been able to find myself better than just looking in the fucking mirror, because the mirror fucking lies to me. You know, the mirror tells me I'm this fucking horrible monster. Every time I look in the mirror, I see this disgusting, awful monster. I see this vile, just fucking foul fucking beast every time I fucking look in the mirror. I hate my reflection. I hate my reflection. I hate it. I always avoid mirrors. I look fucking disgusting. I've always felt that way. Ever since I was little, I've always felt I look disgusting. Hate pictures of me. There's large periods of my life where there are just no pictures of me at all. You know? When I was graduating from high school, you know, they were trying to, like, find pictures of me to put in, like, the fucking slideshow and asking my parents for pictures, and it's like, we have some of you very young and then almost nothing, you know? I avoided cameras so much and avoided all that shit. And how do you explain that in a way someone can understand, you know? I'm afraid my reflection's gonna attack me. That was something I used to be scared of as a kid, and low-key still am sometimes. Like, I don't know, I have this weird belief that I'm gonna look in the mirror and then the reflection is gonna, like, move without me and do something really fucked up. You know, I don't know why. That's just kind of a weird fear I've always had. Like, going to the bathroom in the middle of the night as a teenager, I was always afraid that was gonna happen. I don't know, man. I guess I'm crazy. I guess that's the only explanation, right? I don't know. The reason I use the word crazy so often is because, you know, it's you know, I feel crazy, you know? I've been invalidated so much, and I've tried again and again and again to pair my understanding of myself with the reality of what's, you know, happening, you know? And it makes me feel crazy because I can never make them fit. I can never make my own understanding fit with other people's understanding. And on some level, it's like, yeah, people will never understand you. Yes, you know, obviously, you know, other people's understanding of you will never match yours. Okay, yeah, but when there's such a huge divide that you're calling my experience psychosis and I'm calling my experience something else that I can't put words to that you can understand, that's, that's a little more of a fucking divide than I think there's supposed to be, That's a little more than the average, you will never be fully understood. It's interfering with my life. It's a misunderstanding that is interfering with my life, interfering with my treatment from my doctors, interfering with my treatment from the people around me. I've had friends leave me through this whole thing, friends that I deeply cared about, who left because of their understanding of my experience, And, they are kind people, and I think if they truly understood what was happening, I don't think they would have left. I don't think they have the correct understanding of what happened, which is deeply unfortunate. I didn't really get much time to explain myself because of how things went down, unfortunately. And I miss them every day. They were really, really good friends that I really valued. Really valued. No human should be expected to navigate the world alone. Nobody can navigate the world alone, and especially if you're disabled, you cannot navigate the world alone. You cannot navigate the world without help, in general, and especially if you're disabled. Nobody should be asked to go through life alone. Nobody should be asked to do that. But if the people in my life reject me, reject my identity, reject my basic human experience, what am I supposed to do, What am I supposed to do? Who am I supposed to go to? Apparently a camera on the internet is where I go to, because, sometimes this is the only place I feel like I'm understood or listened to. Whether that's true or not, that's how I feel. There's nobody talking back to me to prove that they don't understand, unless I look at the comments. I should be nicer. There have been some really kind comments. There are some really lovely people in the comments. There really are. There really, really are. And I should listen to those far more than I listen to the other people who are saying not kind things. But I don't know. God, this video's gone on too long, and I actually do have a doctor's appointment today. So yeah, actually, I don't know how long this is. I don't know how long the video is. I really should pay more attention to when I hit record so I can actually know how long I'm recording, because I don't know. I have no idea. But I do have an appointment very soon, so I should end this and, yeah, and also just end myself. Ha ha ha. No, that's a joke. I'm not going to. A terrible joke. I shouldn't make that joke. People are actually very concerned for my safety. I should not make that joke. I'm fine. I'm not gonna fucking off myself. I'm gonna live through this, because theoretically, someday things could get better. Maybe, possibly. Maybe I'll finally fucking make some friends who, have my back. I actually hate the way I said that. It's not that people don't have my back at all. That's not true at all. It just feels that way. In moments like this, where I'm feeling this way, it feels like nobody has my back. It is not entirely true that nobody has my back. But I do... Also, at this current moment, everybody in my personal life does see me as a little nuts, as a little crazy, in a way that is affecting relationships, and in a way that is affecting their respect for me, frankly. And that is a true statement. It is unfair to say nobody has my back, but it is fair to say that currently, by all of the people in my life, in my personal life, they do see me as crazy, and they do see me as, and it does affect how they treat me, and it does affect our relationships. And they do not see these videos. They do not watch these videos. They do not hear this side of me. They do not hear me explain myself in this way, because they do not take the time to listen. And I dearly love all of them. I love every person who is in my life, who has been a part of my life for a brief time or a long time, and everybody who is currently in my life. I do love them, because the issues of that do not come from them being bad people. The issues of that come from what society has told them I am. What society has, what their own friends or church or, people in their life have told me I am, what their understanding of the world has told me I am. It is not their fault. And a lot of them are trying to love me through it anyway. And also, they definitely are not respecting my experience, and they are not respecting my pain, and they are not respecting my reality. And these are both true statements. That they love me, and they are unable to respect me in the way that I need because of what they've been taught. And that's hard. That's a hard place to be. It's a really fucking hard place to be. And it's not fair, and it's not just, and it's not right. And it hurts, and I just really fucking hope that there will be a day, there will be a time, there will be people that I can, who won't see me that way, who will see me, who will see my existence as valid and see my understanding of my existence as valid, and that even if I'm wrong, man, I know I'm wrong sometimes. That's the thing. I know I'm wrong sometimes. I know sometimes my anxiety gets a hold of me. I know sometimes my interpretation of events isn't right, but you know what? Invalidating that experience further doesn't help. I just want someone to be on my side. I just want someone to be on my side. Yeah, maybe I am wrong sometimes. Do I have to be right every time for someone to go to bat for me? Do I have to be completely factually correct in all elements of everything I ever say, in every way I ever speak, in every experience I ever relate to you? Do I have to be completely 100% all the time factually completely correct for someone to be on my side, for you to, to have compassion for me, to stay with me through that, Everyone's wrong sometimes, man. I'm just wrong, I guess, in a way that is considered just not fucking valid, I guess. I don't know, that's the only conclusion I can come to. Everyone's wrong about their experience sometimes. Everyone's... I don't know, man. I do gotta go. I think I gotta go because I gotta get ready. I gotta get going. So, oh, this was depressing. So, I don't know. I don't have a way to end this. I don't have a way to wrap this up. I'm just struggling. So, there's that. If you'd like to leave a comment, please be kind. Just in general, man. Just in general, please be kind.